So looking at the carpal bones on the palmar view of the left hand, we'll start right at the articulation of the metacarpal that will go to the thumb here. And here we have the trapezium, the trapezoid, the capitate, the hamate, and then proximal we have the scaphoid, the lunate, and then over here we have the triquetrum, and on top of the triquetrum we have the pisiform.
So now we're looking at the left hand, but instead of the palmar side, we're going to look at the dorsal side. So we don't usually see hands like this in anatomy class, so we just wanted to go over this. If we have metacarpal 1 here, this being the thumb, we can start our acronym here. At the trapezium, trapezoid, capitate, hamate, and this hook actually would go, it actually comes anterior like this. So this is reversed, this is going inward into the table. And then the proximal row you have the scaphoid, lunate, triquetrium, and pisiform. And the same thing I said about the hook of hamate is true about the pisiform. This stone P is coming out in this direction. So this is upside down. And then we have, of course, the radius and ulna. This is the dorsal view of the left hand.
All right, now that we went through the anatomy of the hand and the carpal bones, we will now go with a helpful acronym that you can remember, starting with the distal row of the carpals. That they can't handle such lines to P. And this is, we're starting with the thumb side for both of them, starting in the distal row, and then moving back down to the proximal row, again on the thumb side, and going to the pinky side. All right, now that we talked about the anatomy and where the bones are actually located, we'll now talk about what is connecting the carpal bones to the metacarpals and the radius and ulna. First, we'll start proximally with a radiocarpal joint, which is right here, as you can see by the pen, and that is a joint between the radius, the scaphoid bone, and the lunate bone. The other proximal joint between the ulna and the carpal bones would be the TFCC, or the triangular fibrocartilage complex, and it serves as a connection between the ulna and the carpals, but another group should go more in depth with that. The next joint that we have would be the mid-carpal joints that runs in between the proximal row and distal row of the carpals. You can kind of see by here. The mid-carpal joint is made up of dozens of ligaments, and it provides a gliding motion between the carpals. The last joint that the carpals articulate with the metacarpals are the carpo-metacarpal joints. As you can see, the most important joint here is between the trapezium and the first metacarpal, or the thumb, and that is because this is the only joint that is a saddle joint, and it has extra mobility. The other joints articulate between the trapezoid and the second metacarpal, the capitate and the third metacarpal, and then the hamate, and then the fourth and the fifth, which connect to the hamate.
Now that we've gone through some articulations and the basic anatomy, we can look at something that's particularly interesting about the hamate. The hamate has something called the hook of the hamate, which kind of looks like Pride Rock coming out of the hamate. This forms the Guyon's canal, and in that canal, the ulnar nerve in orange runs through and then distal towards the pinky side. Now this is a cause for injury for bikers because they have their hands on the bars like that for extended periods of time, and that can compress the nerve and cause them to lose feeling.
So now we're going to talk about another very common injury to the carpal bones, and that is with the scaphoid bone. This is in fact the most fractured carpal bone, and the main way that people fracture their scaphoid bones is by fooshing. A foosh, again, is a fall on an outstretched arm, and so what happens is people reactively put their hands out when they're about to fall because they don't want to hit their face, and they may land something like this, and then there's all this force coming down through that radius right into that scaphoid bone, and it can fracture, and it does fracture very commonly. And this is a very big issue because there's actually poor blood supply to the scaphoid, which leads to impaired bone healing. Another interesting point about this is that many people mistake a scaphoid fracture for just a strain, and it could be weeks, sometimes a month before it actually gets diagnosed as an actual fracture. And one last thing about this drawing is that I'm human and I'm not a perfect artist, and this should indeed be more lateral. And I know you're thinking lateral, that's medial. Well, this is the anatomical position. So this is supposed to be shifted over like this. The scaphoid is more like over here by the anatomical snuff box. So just keep that in mind.
To wrap up here, just a couple more interesting tidbits about these particular bones. The lunate here is the most dislocated, and the pisiform here is an example of a sesamoid bone, similar to your patella, where it's actually suspended inside of a tendon. Scary, spooky skeletons.